today's highly anticipated webinar where we're going to dive into the transformative role of artificial intelligence in modern dentistry. We're honored to have us a true pioneer in the field, Dr. Vivian Rockne, Rocknia. Dr. Vivian Rocknia. Doc Rock is a visionary implant dentist, a leading advocate for integrating AI and advanced technologies in clinical practice, and the owner of Implant Dentistry by Doc Rock. With a doctorate of dental medicine from Temple University and a strong background in psychobiology from UCLA, West Coast, she has spent nearly 2 decades revolutionizing patient care through cutting-edge technology. Beyond her practice, Doc Rock is a distinguished faculty member at the Renzick Implant Institute and at the Misnick International Implant Institute, where she mentors, trains dental professionals in advanced techniques, including CBCT-guided surgery and laser-assisted periodontal treatments. She has lectured on national and international platforms, contributing to key research in AI-driven aesthetic dentistry, and even played an instrumental role in bringing dental innovations to platforms like Shark Tank. Today, she will be sharing her insights on the AI advantage, transforming dentistry for the modern clinician, where we'll explore how AI can optimize practice efficiency, enhance patient experience, and elevate the clinical decision making. And again, as I said, as we were all trickling, please stay until the end to do the survey so you can all receive CE credit. This is our power part of our 3-part webinar series of Money, Power, Respect. And please give a warm welcome. And without further ado, Dr. Vivian.
Thank you, Dr. Sorrell. It's a pleasure and honor to be here with you guys. And I hope this is informative, and I will give you my contact information at the end. I would love to hear from you, questions, reaching out with whatever it is that you're working on. Maybe I can be a bit of a help. Anyhow, let's get started. So a little about myself. I'm a general dentist. Today, I'm going to, for this, I also identify as a technology entrepreneur. I do work with quite a few startups. And so as this presentation progresses, I will talk to you about some startups that I've worked with in the past and what they've been working on, some that I'm currently working with and what I see in the horizon, but I won't be able to give any specific names on those. The products that are actually out and available for the general public are the ones that I'll actually talk about the brand names for. So a little bit about myself. Well, I went to undergrad at UCLA and studied psychobiology there. I became a dentist at Temple, and several years thereafter, I received 2 certificates from the Cornell University School of Hotel Management and Hospitality, where I learned how to market services and also how to sort of level up altogether on the fact that we're all really service providers. What I found interesting in that coursework was that there was always at least one dentist in my class. So for myself, I thought, that's kind of interesting. But when you really look at it in the bigger picture, be it going on vacation or going to a dental office, we're all providing an experience in a moment of vulnerability or an important time in someone's life. So that was interesting. Current employment, this is a little bit of the tip of the iceberg on the things that I do. My practice is in Beverly Hills. It's called Implant Dentistry by Doc Rock. My practice is basically just implants, obviously. I do a lot of laser surgeries and then clear aligners and tons of 3D printing in there. I've been teaching with the Resnick Implant Institute, gosh, since they first existed. And then before that, I worked with Dr. Carl Misch, one of the early founders of implant dentistry. I was his right hand for the last 5 years of his life, helping him with his textbooks, his publications, and also coming along as well on his speaking engagements. Beyond that, I'm a associate professor at Temple's oral surgery program. Temple has two oral surgery programs. One of them is medical school based, the other one is dental school based. I talk to and teach the residents management of larger treatment plans. I talk to them about newer technologies that are available, as well as managing implant complications. Finally, I'm also the chief clinical advisor for Flouse, which is the world's only slash first electrical floss product. We were actually on Shark Tank this last May on the season finale, and we did land a shark. So I'm very proud. Anyhow, that's my background, and I'm going to share with you a little bit about my practice. So my practice is located actually in the shopping district of Beverly Hills. It looks just like the way you think that it does on television. By all means, if you're ever in the area looking to maybe write off a little shopping trip, please reach out. I'd love to see you in person and show you around if you like. You know, being in Beverly Hills and being on in a world where I talk to a lot of dentists, there's always sort of a face that they make when I say that my practice is in Beverly Hills. They kind of, their eyes open up a bit, and there's an impression that there's probably money coming in from the windows and out the faucets and things, but that really isn't the case. Let me discuss with you the density of dentists in Beverly Hills and the way that that's altered my practice. Well, Beverly Hills is about 5.7 square miles. According to Health Grade, there are about 3,615 dentists in that little bitty area. So what that really comes down to is about one dentist for every 9.7 residents. Just so you guys are aware, wherever you are in the country, on average is about one dentist for about 1,600 residents. So one's got to think, are you kind of crazy to open a practice there? Well, let me dive a little bit more into that logic, and then we'll circle back and tie it into this topic. So, sorry about that. So the three most common questions I get with that is, why would you choose that area? Well, it's walkable. I have about 12 hotels within walking distance to my practice, which I have patients come from all over the United States. Usually I'm managing complications for them. And so when they come in, I help take care of that. It's easy. It's a little bit of a vacation destination. But along with that, the question is, okay, well, with so many dentists, how do you stand up out? Well, we do some amount of concierge dentistry, but a lot of what I also implement into my practice is different kinds of technologies, be it like something that I recently saw or something that I know is going to keep my patients either comfortable or certainly give them something to talk about. Beyond that, it's what do I do differently? A lot of my practice philosophy has been approaching it from an omnipresent perspective. And I use AI quite a bit in doing that. Aside from that, my office is a little bit of a tech sandbox. So when I'm working with companies, they'll send stuff over. We play with it. My patients get to play with it. Again, something for them to talk about. But really, at the end of the day, there's really a focus on just being hyper efficient while I am in the office in a way that really shows my patients that I both respect their time and I also want for them to have a fantastic overall outcome, knowing that I'm present within whatever it is that they're doing. Little background on me, I on average fly about 10,000 miles a month. So I'm all over the place. With the use of AI, I'm able to communicate with my patients, either myself personally or one of my chatbots that seems very similar to myself at all hours. So even when I'm in a plane, I can see the conversation as it's happening on my phone. They never feel like they're alone. So AI for myself has been a way that I've been able to open up my career more. And it's also given me the kind of freedom that I can look around and see what else is out there. And it's also given my staff a tool that they can actually focus more on the things that they're better at doing. And we're then able to then decrease the amount of stuff that maybe they don't like to do. It's helped me quite a bit with just keeping my team both more efficient and keeping my overall number of staffing really sort of lean. So let's jump into it. So, what is AI actually? Well, artificial intelligence enables computers to sort of mimic our intelligence. But we've come to learn, particularly the last couple of years, that we've gotten to a point that not only is it able to have its own language that we aren't aware of and understand, um, it's actually starting to show that it's smarter than us too. So, which is really an interesting ethical question as we progress through this presentation. But we get language processing and image recognition, which I'll talk a little bit more about down the line. A lot of speech and text recognition, which has been really helpful when I have patients who come from different parts of the world and don't speak a lick of English. It's been super helpful in that sense as well. Problem solving tasks, but a lot of people tend to associate AI with generative AI, which is basically like ChatGPT or Claude. But there's so much more to AI than just that. Let's talk more about that. So, what is it? Is that it's actually been in healthcare for a very long time. So there were early expert systems that started in about the 1970s where they started really feeding information to computers in hopes of making these searches easier and more efficient. Now, as time has gone by, we got into more advanced machine learning, which is really just the overall dumping of tons and tons of information, which is why these more recent GPTs have been so expensive to build and also so time consuming to build. And now we're actually getting more into deeper learning tools that are really transforming our field. And that's where the AI itself gathers all this information, digests it, and then with that, then creates additional products or concepts that we never fed it to begin with. It just brings it all together. Currently, as we speak, AI is used quite a bit in dentistry, in imaging. It's being used in diagnostics as well. It's pretty cool the way they're doing that. I'm starting to see a lot more personalized medicine, and I think we're going to get more into that as the years go by. Obviously, we've all seen the Yomi robots, and there's actually even been a drug discovery with AI where a drug was found, and it was found in a way that there was no research being done specifically in that direction to be able to discover it. I think that's pretty amazing. Now, the future healthcare journal research says that it's going to significantly reduce inefficiency in healthcare. I hope so. It's going to improve patient experiences. Gosh, can you imagine there possibly being a time where you don't have to think about Yelp or Google reviews because AI's got your back? Um, it'll improve patient flow experiences as well. And you're going to actually, in a time where uh, provider burnout is actually a real topic that we're starting to discuss amongst colleagues, I think it's actually going to help relieve a lot of the pressure on our shoulders as well. And hopefully improve patient safety as well. As somebody who lost a sibling specifically because of human error, the idea that there's going to be AI that's going to help keep that kind of error from happening for me is, gosh, I wish it happened earlier, but I'm so glad that it's something that's going to be available to keep us safe. So today's goals, we have a lot of them. I hope we can click through all of them one by one for you. Is we're going to discuss how AI is transforming clinical workflows, how it's going to change diagnostics and overall patient engagement, and also different ways of streamlining scheduling, treatment planning, and overall patient communication, which are things that I love to do. We're also going to discuss AI-driven marketing and data analytics. I will talk to you a little bit, if you like, on how to attract and retain these higher value patients with different kinds of methods that are available. We'll also discuss a bit on how AI can support evidence-based decision making. What I'm seeing is that as products are being developed, there's also a development of how possible a positive success rate for the patient would be based on whatever the treatment plan is. So we'll go a little bit further into that as well. So topics I'm going to discover, all broken down, are going to be AI in clinical practice and patient care. We'll go through patient practice management, a little bit on ethical, educational, technological challenges. Happy to share all kinds of bloopers in my office that have happened with that. Some cutting edge uses in dentistry that I think are exciting, what the future is going to look like, and some possible challenge and solutions. And then in the end, we'll open up the floor for question and answer. So let's dive in. So AI in clinical practice and patient care. Well, what I've seen is that there is really like a trifecta in managing it and really implementing right off the bat within your practice. With diagnostic support, you're getting like the algorithms are getting to be a lot more accurate on what they're looking at. So specifically as it pertains to x-rays and being able to read them and show the patient what's there from a neutral third party. Treatment planning, I think Overjet does a really cool job of it, and I'll talk to you about that as this presentation progresses, where you get some predictive analytics, and it's also going to then tell you what maybe you have not noticed in your treatment plans, as well as using it for patient management. So, like scheduling, real time monitoring, something that I love to do is virtual smile design, both where my patient can see what they would look like and then implementing 3D printing along with that, which we'll dive into that too. So let's jump into clinical decision making. So the algorithms right now are able to help with diagnosing diseases, treatment planning, predicting some of the outcomes, and also managing what the population health looks like. So on one end, I think for a lot of clinicians who maybe went to school during COVID and didn't get as much of a chance to really practice treatment planning and diagnosing and seeing tons and tons of radiographs, I think this is a fantastic way to kind of help them be along in that road of being more efficient. Something that I think all clinicians, regardless of age, can really benefit from that Dr. Mish used to always say that when you're looking at treatment planning a patient or just providing any sort of overall care, really the discussion is a little bit less so of the plan itself and a lot more so of keeping an eye out on those higher risk patients, the ones where whatever that you're going to plan is not going to necessarily have the positive result that you may want. And so that kind of machine learning where it can start to notice the more risky type patients is, I think, a fantastic way that we're going to get more into the appropriate uses of dentistry and a more tailored treatment plan for different kinds of patients. So beyond that, I mean, at this point, we can use AI to analyze images like X-rays. It can be used for CBCT. I use it that way all the time. It's also getting into being able to analyze photographs for pathologies, which I think is pretty interesting. And all of them at this point, to a large degree, can be used to identify decay, periodontal disease. It's gotten a lot better at noticing the different kinds of bone levels, as well as different kind of abnormalities that aren't necessarily visible to the naked eye. Gosh, I remember the days where we used to have these x-rays that were like this big. And I used to always think, wow, the treatment plan really comes down to how effective that doctor's reading glasses are to be able to read something so little. And then once we then transitioned into digital and you can blow up a whole x-ray to the size of your screen, I thought, wow, we're going to be able to catch everything. Well, not necessarily. I think with the use of AI, not only are we getting a lot more sensitivity on catching treatment, but I think the days of our really saying, okay, well, we're going to keep an eye on it are going to be decreased quite a bit. And also the discomfort that comes along with the provider wanting to actually diagnose because of maybe being nervous of diagnosing too much, that sort of gets stepped away as well. We now have what we can consider a neutral third party where you have the dentist, you have your patient, and then you have the photos that the AI is then showing where some of this pathology is. And you have clearly a product that isn't necessarily receiving any sort of benefit by just showing exactly what's on the photos, which I think that in the bigger picture is going to help all of us as clinicians. So enhanced imaging analysis, we're going to talk a little bit more about it, but we're getting a lot more proficiency in also detecting little proximal cavities as well. And we're also, because of that, it also puts us in a position where we can be a lot more proactive in early intervention. For example, I don't know if many of you guys use any sort of other kinds of products or paste or anything else for your patients with, hey, your decay is starting. Let's see if we can put a stop to it. But with this use of AI and showing what's starting, that conversation is for sure on the table. And we really can't continue to say we're just going to keep watching it when we have all of these tools at our fingertips, really, that are there to make sure that we're taking the best care of our patients as we possibly can. So we'll talk about Overjet. What's interesting is that it uses iris imaging to integrate, and I'd say at this point, most cloud-based CRMs within your practice or overall practice management softwares are able to then properly integrate into it. And so it's going to not only just analyze, it's going to make your x-rays more clear, and it then brightens up what's there so the patients can really see it for themselves. So you're going to see the decay more noticeably, the periapical radiolucencies, the bone levels, how those bone levels change, and then of course calculus as well. Again, this is a fantastic neutral third party, and that you actually have a tool that your patients can easily understand. I know it's common for patients to want to say yes, they understand when you're talking about x-rays and not really get and absorb what was shared with them. This then changes it. It color codes it all. It makes it very simple. It's also really great with early detection, I mean, even in kids down to 4 years old. So it's it's a nice way of helping protect our youth as well. So the way the imaging works, it's going to enhance or clear up any sort of blurry resolution on X-rays. It's also going to get rid of any sort of noise that's within your X-rays as well. And with that, it's just creases or little things that you really don't want for your patient to be distracted from. And it's going to create a nice, clear view so you get a more precise diagnosis and treatment planning. Now, Overjet, which is kind of interesting, also has a section within their software where it will take a look at whatever you've treatment planned, and then there'll be a separate section of these are things that are noticed within the radiographs that you have not put within the patient's treatment plan. Fantastic little game that I think is great to play for specifically younger dentists is how many things can you treatment plan on there and keep that list as short as possible. But also for the more seasoned offices, the question really then becomes how much treatment is actually on the table that I'm not looking at, and maybe I should reconsider the way that I'm practicing to help with catching that to provide a more comprehensive, thorough experience for my patients. And I mean, I think it'll also help out in the bigger picture with overall practice productivity as well. So, speaking of practice productivity, let's jump into practice management. So, it can streamline scheduling and billing, and it really kind of gives a chance for us providers and also our team to be able to focus more specifically on on what patients really want and giving them their own personalized care. These chatbots are pretty fun. Sorry, and that your patient can really just press a button and it will start communicating with them, and you can actually have it communicate with whatever kinds of tones you like, or whatever kinds of verbiage you prefer as well. I typically within my chatbots like to put that to keep the conversation in a warm and friendly manner. But it really comes down to whatever your personal preference is. I think there's at this point about at least 30 different personality types that you can pick in there as it pertains to how it communicates with your patients, which is kind of nice, but because you can't really do that with your own team. I mean, our teams, we all know will have a bad day and can possibly pick up the phone with yes. But you know, consistently, it's going to, your chatbot is always going to have a very consistent tone and remain even keeled the whole time. Even when arguments happen, I've actually tried to do a pretend argument with it to see how I can get it to sort of rattle its chain. It doesn't have a chain, so it can't rattle. Another interesting product or company is Pearl with their pre-check. And this has been a really helpful tool in the sense that it's helped with automating a lot of the insurance verifications. So I'm not having my team sit down and go through manually check out what coverage is, what their real correct copay is going to be, and then also what's the likelihood of insurance actually paying for it. And so this is a fantastic tool in that it pulls insurance details from a variety of different places and it gives a comprehensive view on what the coverage is going to look like. So, and you also get some sort of feedback. And so there's a decrease in unexpected costs for patients, which oftentimes, if you are a insurance heavy practice, it's a fantastic tool in that sense. To a large degree, I'm fee for service because insurance doesn't usually cover the things that I do anyway. However, when we do treatment plan and present treatment, we also do send in paperwork to the insurance for as a convenience to our patients. And this has been helpful in giving more of an accurate idea as to what your real out of pocket's going to look like after your insurance pays whatever they're going to pay. So that's been really helpful for them too. So you get a nice breakdown. They get to see what their benefits are, what their limitations are, and they also get an idea also of what their history is. It's common, particularly in my practice, that by the time they've come to me, they've already gone to 4 or 5 other docs. They're already aware of what's going on, and oftentimes insurance isn't going to pay for more and more and more X-rays, particularly when they don't want to share that, hey, I'm shopping around. So this helps out with giving that in a much more time efficient manner as well. And it really streamlines the workflow for my team. I don't have them sitting around uh, any sort of overtime or anything, or coming in early or using extra time to get this information. It's all fairly streamlined, which is really nice. Now, jumping into teledentistry. You know, I feel like a lot of us dealt with teledentistry first during COVID when we were all separated to some degree. And our idea of teledentistry, at least mine, was looking into the itty bitty camera on my computer and thinking to myself, this resolution is terrible. How in the world am I going to possibly create any sort of service to my patients? Now, it's come a long way. Now, granted, several years have gone by since then, but we're now able to use a variety of different, aside from chatbots, but different diagnostic tools as well to be able to see what's going on within the patient's mouth and then take care of their needs more effectively. And aside from that, it's also a great tool in that it's really expanding access to our underserved communities too. I I had a lot of patients around COVID time who would travel 2 3 hours just to come see me because everybody else was locked down and closed and they just needed some sort of help. The ability to now be able to save somebody from spending that kind of time in transit, I think is going to be a godsend to a large degree. So I came across this company, and it's interesting in that they can call themselves a virtual dentist. They are using AI within it. They call themselves minimally invasive, which does make sense in the sense that you have a screen separating you out. And within the website itself, it says without needles, drills, or shots, which makes sense because you can't reach through a screen to uh, to provide those services. However, what I found really interesting is that I think this is going to be something that's going to come into a lot of our own practices as time goes by. That we're going to have our clinical days, and then we're also going to start having our days where we're just in front of our screens, hopefully someplace nice and comfortable, and maybe even in our sweats, and providing a service for our patients, not necessarily in the practice. So I think this is a great company that soon enough is going to be something that's a lot more common within our world's day to day, regardless of how big or small our practices are. Smile simulation. I really enjoy this for a couple different reasons. Now, number one, there's this company iSmile Simulation where patients can actually they take a selfie and they can actually upload it and see what their treatment would look like. And it helps out in the conversation of what the patient can expect from their treatment and also what's a realistic expectation. Also, what will they look like as well? Uh, a company that I like to use that I have in my arsenal of services within my practice is SmileFi. What I like about it is there's an unlimited number of different kinds of smiles that a patient can have. And so we'll take our pictures and they can try a variety of different smiles in their mouth. They can see what their picture looks like. What I really love about this is they'll actually put together an STL, and based on whatever my patient picks, I'll usually have them pick like three different options. We'll 3D print that in the office and let the patient try it on within the practice. What's made that really helpful within my world is that not only is this person trying on actually in their mouth what it looks like, they can actually take it home and try it on in front of their significant others, in front of their families, whoever else. They also have a real informed consent experience of this is what it's going to look like, but better once everything is all done. So the days of showing a wax up on a typodont that's gosh, mine used to always come gray for a while. Then eventually they turn white. I don't know who finally came up with that brilliant idea of putting a more realistic color on our wax ups. But those days of them patients trying to understand or imagine have really come down quite a bit. Now it's this is what it's going to look like in your mouth. This is where your smile line is going to actually be. And this is how it's going to even sound when you make different kinds of vowel sounds. So there's documented cases of patients going through changes in overall full mouth reconstruction and their smiles. And because they're saying S sounds or F sounds, and now they have a speech impediment, there's some sizable litigation behind it. Well, with this, we're minimizing that as much as possible. So I look at it as both a safety net in that sense, real informed consent, and you also get that feeling of excitement of, wow, this is what could be. This is the hope for the future of what my smile could look like. And from a different perspective altogether, if there is any sort of financial barriers, this is something that my patient can go home to their family, to their spouse, and say, I know this is a sizable amount of money, but this is something that can make this kind of difference in my life, be it the ability to have more confidence or the ability to hopefully maybe even land a better job because they now feel better and they're not covering their smiles anymore. So, the way AI meets implants. Well, this has been a huge topic within my career. I really dove into it, gosh, about 2016-ish when software was coming out of 3D printing guides that would do both the guided surgery or of guided all on X and then the guided 3D printed prosthetic as well. There really weren't a lot of companies back then who were doing it. Now it seems many of them have popped up. Just as many clinicians are now doing providing the service as well. But the precision that comes out of it and the predictability out of it has really become, to a large degree, what I'm starting to see eventually a standard of care in that we know for sure where exactly our implant is going to be. We know for sure the amount of bone that's going to be around the implant. And we also have the ability to analyze the bone density around the implant all 360 degrees. So we get a much better overall result. And as I show my patients, because I have every slide of it printed out and I 3D print the guide in my office as well with their name on it. And the patient always goes home with the paperwork, with the printed pictures of what their CT scan looks like of their implant in the most perfect position. And for myself, it's been a pretty sizable practice builder in that I have patients who go home and they say, my doc placed my implant in about 10 to 15 minutes. And I know for sure it was perfect because this is how it went. This is how it looks. This is how it looked way before when she was designing it. And this is now how it looks in my mouth right now. That conversation is pretty powerful, particularly for patients who've had implants placed, like the old fashioned way of doing it all by freehand. So you get a faster result, a better result, and you also have a result where, because we know where the implant is going to be, we also know if we want to put a provisional on there that we can 3D print that and have that ready on the day of surgery. Now, full transparency, I have an implant right there that is that's healing, and I have a provisional on it. In a couple of weeks, I should have my final implant crown placed on there. But it was all 3D printed the same day that I 3D printed my surgical guide. A company who's doing this is DTX Studio, and they do a great AI use of implant planning. They'll put the teeth in there based on what the AI believes the occlusion is going to be, and then they can also evaluate whatever the prosthetic needs are for your patients. So let's get into ethical, educational, and technological challenges, which is it our abilities to provide a much more comprehensive experience using AI. A lot of ethics is going to really be a bigger topic within it. And also the way that we train our up and coming docs as well. So, balancing all of that, there's two ways of looking at it. There's the idea that there could be an over reliance, that it's used in place of clinical intuition or maybe even as a crutch. I would say, don't worry, we're not going to be replaced anytime soon, just yet. But it's a great tool in ensuring that we're not overseeing anything. I actually trained a GPT to know a lot of the things that I know, and even with that, I'll feed it some information, and then I'll ask it, "Am I leaving anything out? Am I leaving anything on the table that I should be aware of?" And so I think that using it as a way to supersize your abilities is a more realistic approach to the implementation of AI. Another thing is transparency in decision making. As much as we're trained within it, it makes the most sense, obviously, to share with our patients and our peers, hey, this was all based on what AI generated, and the models that are created are based on some sort of logic. There was a period of time where you could ask your GPT or Claude a mathematical question such as like, what's 2 plus 2, and the answer would be wrong. So again, it's getting better, but we really can't use it in ways that are not easily explainable with our own logic. There's also patient data security as well. Oftentimes, patients don't want for their information to be put in these technologies, which is fine. As we start to get used to it being part of our culture, I think that our behavior towards it will change. But for right now, I understand the amount of skepticism and maybe discomfort. And beyond that, we also need to keep an eye on HIPAA and our overall regulations for privacy within our field. Now, in dental education, I have a lot of interns in my practice who work with me day to day, and a lot of their experience as STEM majors is them trying to get a thorough education without the use of AI. So they're still in the transitioning part. But I think in the next several years, we're going to have a whole different idea on how we both train our newer clinicians as well as ourselves in different procedures. And so there's going to be a more personalized learning path for students. AI can be used really to create a more even playing field in grading, which I think is going to be fantastic. And also in great training modules as well. I actually played with one of these in a plane a couple weeks ago. I played with something similar to Immersify Education. I can't go into more detail than that on it, but Immersify is a really interesting company in that it's an online platform that is actually interactive. So I get my interns playing with it where they feel like they're practicing to be in dental school, and they're learning about what's going on. They get questions within it. They get to play with it in that sense. And it helps with bridging the gap between what they're learning in the class, what they're reading at home or online or wherever else, and then what the reality is in clinical practice. And it all kind of comes together in a way that's interactive and fun for them, in a way that's also culturally relevant, because we're also dealing with a group of young-ish adults. I call them young-ish because at 45, I feel like everyone younger than me is young-ish. Um, so you have these youngish adults who are using their thumbs to press and make decisions and scroll and learn. And so it follows along with that same kind of culture as well. So let's talk about the future. and what patient-centered care looks like and what I'm sort of seeing as we look ahead. There's so much to say and there's so much to be excited about. The AI innovations that are on the horizon, once we start to really play with them, are really going to change a lot of the way that we take care of our patients. And it's also really going to change a lot of what our own day-to-day lives are going to look like. Now we're at a point where AI can be used to write our notes, to automate that. It can be used oftentimes to create a variety of different treatment plans. We're using it for a variety of different forms of informed consent. But it's also going to be used in ways that I think we can only maybe be a little bit envious that we didn't have these things earlier. So let's jump into that a little bit. So it's going to be a lot more personalized treatment. Now, I'm seeing a lot of this with some docs in my neighborhood in that they are tailoring treatments based on a person's genetic and lifestyle factors. There's a lot more emphasis now on what the family history looks like, as opposed to whatever's happening in your mouth and that's about it, or whatever your immediate relatives went through. There's also more conversation on lifestyle factors, including airway and what that looks like for the patient and keeping them more optimized. So it's going to help tailor those things. There's a lot of push right now in getting all this information into the AI so that it can read that better. We're also getting into more predictive maintenance, which is another interesting topic that insurance companies are talking about now, where they're creating algorithms, oftentimes within some of our products, that are going to help with anticipating health issues before the symptoms even show up, which I think is really interesting on one end. But on another end, like, do we really want our dental insurance keeping an eye on what's going on in the bathroom? That's for each of us to think about on our own. With regard to teledentistry and remote monitoring, it's been, from what I've seen, a great way of keeping an eye on patients, particularly those who are coming from far away. I mean, I have patients who, again, travel from either a couple hours or have to take a plane to come see me. And the ability to have them take a picture, and I'll send them with retractors, get a thorough, accurate picture, put it through some imaging, see what's going on. Those are some monitoring efforts that I think are going to help with keeping our own in-office chair time to be much more efficient. We're not having a lot of the in and outs coming in of, let me just take a quick look. And we also have the ability to do some continuous monitoring. Again, we're going to have products that are coming out that are going to monitor our habits on how we do our oral hygiene. And with that habit monitoring, it'll then roll into information that we'll see as clinicians, as well as if our patients have any sort of insurance coverage, they'll see it over there as well. Really interesting. So, other really cool stuff. um, the drug discovery aspect of it and drug repurposing. This is a really hot topic the last several years, in that the algorithms are starting to be fed different kinds of off-label uses for these drugs. And with that, it's starting to create with it different ways of them repurposing it. Now, from a drug manufacturer type perspective, this has implications on them keeping their patents or changing the over the counter abilities of some medications. But on a different level, I think it's going to really alter our overall bill on how much we're spending on pharmaceuticals, because that same amount of research isn't being done anymore on some drugs that are then being repurposed. Biomaterials are super exciting one, particularly for implants. I'm seeing different materials being generated and 3D printed that can turn to bone, that can integrate more quickly. Robot assisted dentistry. You know, I did a poll and just asking patients, how would you feel about a robot doing any of your procedures? For right now, what I'm seeing is patients are more open to having either their tooth whitening done by a robot or cleaning done by a robot. So, at least for us clinicians, I think we can rest assured that so far we don't have to worry about our day jobs. um, Also, a new one that's also coming out that I'm excited for is surgical precision using instruments. So our instruments are then going to have a better idea as to what exactly is going on in our hands. Now, that's going to clearly change the way we disinfect and the kind of sheathing and covering that we use of our instruments. However, we're also going to know that our inventory of instruments is likely going to come down because they'll be smart. Kind of cool, right? So some challenges, solutions, final thoughts. I've because I use my practice as a bit of a sandbox, I can tell you that probably half my gray hairs are from some of the challenges of playing with and trying to implement. And and I'll share with you some of the barriers that I've come across. So some barriers are the data quality and the access to getting the data. Really, the way that our AI works is similar to our own bodies in that it's only as good as what you put into it. There's also technical infrastructure issues where the technology that you may have within your practice is stuck in a way that it won't accept additional incoming, be it bridges or patches that'll help it then move along. There's also our trust in it and how reliable it can be. It's still uh, a technology that's still learning, and so because it's still learning, there are questions on how reliable it can be used. So let's jump into that a little bit more. So data quality, uh, you know, gosh, I've been in offices where they've used one software, then another, and all of that charting then becomes inconsistent. And so that lack of standardization makes it difficult for the AI to understand what's happening. It also, with that, there's between clinicians issues of one clinician does things one way, another one does it another way. The AI can't or hasn't been able to compromise within that and find how those two are sort of similar. So we're getting to that point. Um, and because of that, for right now, if that's what we're focusing on in in different bigger clinics, there is a possibility of misdiagnosis or of having faulty analytics. Once all the data gets cleaned up, it's a different ballgame. But for right now, I think even with practices trying to become paperless, this is going to be an issue for a while. So again, software sometimes it's outdated. Gosh, I've been in practices where I thought to myself, don't you feel like you deserve a better software than this? Um, so there's that aspect of it. There's also, like, at the end of the day, a lot of clinicians just don't feel like learning anything else, or our teams may not necessarily want to learn anything else. And so, with that, there's the aspect of I don't necessarily want to jump over that hurdle. And full transparency, completely honest, some of the implementation of these things is pretty expensive. I mean, I've gone down roads where I've thought to myself, gosh, that was a couple $1,000 lesson that I really don't think I needed to learn. However, I know that in the bigger picture, it's helped the overall technology that hopefully as time goes by, it'll then be more useful for all of us. So I guess that's my gift slash investment in all of us. And there's the question of, can it be trusted? There's still a lot of skepticism in it, be it the way that it automates, what kinds of things it might enhance, could it be exaggerating? And there's also a big issue of bias that happens within AI. And that bias happens not on purpose at all, but based on what kinds of information it's fed. And so there can be instances where it may look at a specific socioeconomic status and within that, then consider specific kinds of habits that may not necessarily be the case. So once we teach it to move past those kinds of biases as well, I think we'll also get much cleaner answers or more accurate answers on whatever it is that we're looking to upgrade within our practices. So some solutions are improving the data, uh, overcoming the infrastructure, and then building trust and reliability. So with that, adopting some sort of standardization, I think it's going to be a little bit difficult to do for smaller clinics, but for bigger clinics, and with schools, it's a real thing that can be done, and constantly training the algorithm within it. Uh, Technical infrastructure, as time goes by, we're going to get into a point where we all have to continuously have some sort of cloud coverage of our practices, our charts, our patient information, and have it continuously be optimized so we can then find the information that we're looking for to take care of our patients. And building the trust and reliability, you know, it's interesting in that a lot of it really comes down to the training and keeping an eye out on what it's really doing and what's the real human aspect of it, and just being clear with our patients, our team, of what we're trying to do, and that we're still keeping an eye on our patients and our practices. But this is something that we're doing to, down the line, make it more efficient and more trustworthy. But I think that can even be said with friendships or relationships. In the beginning, there's trust that needs to be earned. So, conclusion: AI is a powerful tool. It isn't perfect. I think we still have a long time until we can get it to a point of being perfect. But for right now, it's a really great tool in making ourselves more efficient and also opening up our bandwidth to be able to do different things within our lives and within our practices. So, implementation, I get asked this very often. So, how do you start? How do you get AI in your practice? Well, first things first, see what your practice needs, see what's available. And the way I usually explain it is I want you to write down for yourself every day when you're heading home what was the biggest pain in your butt that day. And once you start to see a trend, and this can't be a patient, all right? What topic was the bottleneck that made the day more difficult? Once you find what that is, then from there you should be able to find some sort of AI type tool that can help with alleviating that. Because that'll be something that you'll be more excited to bring in. You'll also be more excited to have your team work on as well. And so integrating it will then be a little bit more seamless in the sense that there's going to eventually be some light at the end of the tunnel. And of course, it cannot be more emphasized that keep an eye out on the HIPAA compliance and data protection. It's a big thing, and the breach of this information can create a lot of issues down the line. So, circling back over, thank you guys all for your patience and for your attention. As many of you may know, my city was on fire for a lot of last month, and so I had to push back this recording or this presentation just because the sky was falling. So I want to give a special thank you to each of my interns who helped out in making sure that my slides all made sense. Um, and thank you all for this opportunity to be here and share with you what I see in AI. You're welcome to connect with me. This is my personal email address, vrocknian@gmail.com. You can find me on LinkedIn, and my handle on all social media is at the Doc Rock. My office website is thedocrock.com, and my own blog on AI type topics is drvivian.com. We'd love to hear from you. We love making friends and hearing what's going on in your world or reading about what's going on in your world.